also be available on our website in the future. So I'm going to call this meeting to order at 3 p.m. And we'll begin, as we always do, with the Land Acknowledgement Statement, which reads, "We'd like to begin by respectfully acknowledging that Dufferin County resides within the traditional territory and ancestral lands of the Tianatare, the Attawandaron, the Haudenosaunee, and the Anishinaabe peoples. We also acknowledge the various municipalities within the County of Dufferin reside within the treaty lands named under the Haldimand Deed of 1784 and two of the Williams Treaties of 1818, Treaty 18, the Nottawasaga Purchase, and Treaty 19, the Agentes Treaty. These traditional territories upon which we live and learn are steeped in rich Indigenous history and traditions, and it is with this statement that we declare to honor and respect the past and present connection of Indigenous peoples with this land, its waterways, and resources." I'll now ask the clerk to take a roll call.
Thank you, Chair. Councillor Guardhouse?
Present.
Councillor Hawkins?
Present.
Warden Horner?
Present.
Councillor Little?
Present.
Councillor Nix?
Present.
Councillor Post?
Present.
Councillor Wrench?
I'm here.
And Chair McLean.
Present.
Thank you.
All right, thank you. That takes us to number 4 on the agenda, declaration of pecuniary interest. So members may declare any pecuniary interest now. Please state the interest and the general nature thereof. Declarations must be verbal and in writing and can be emailed to the clerk. Takes us to number 5, public question period. There's nobody in person or online. Were there any questions sent to the clerk? No? Okay. Number 6, delegations and presentations. There are none, which takes us to number 7, reports. Before we go to our first report, I did want to take a moment to congratulate Tom Reed, former chief of the Dufferin Paramedics, who received the King's Coronation Medal this past week. Tom was recognized for his 41 years of dedicated service to the Dufferin Paramedic Services. For those who may not be aware, the King Charles III Coronation Medal is a special commemorative distinction designed to honor Canadians who have made a significant contribution to their community. It celebrates their achievements, dedication, and commitment to the well-being of Canadian society. So I think I speak on behalf of this committee in saying congratulations to Tom for this incredible achievement, and we thank him and his family for their contribution to our community. Yes?
If I'm not mistaken, there was another former county employee who was on the list of people who got the award.
Oh, is that right?
Wayne Townsend.
Okay, great. I didn't see that.
No, you did. That's right.
Was that this year as well? Oh, amazing. Okay. Wonderful. Great. Well, congratulations to all. So that takes us to our first report. So 7.1, the response time standard reporting. So over to you.
Thank you, Chair. So every year we're required to create a response time plan, and by March 31st of the following year, we need to submit a report to the Ministry of Health on our performance. We're allowed to select the percentage for what we will respond to within. The time targets for sudden cardiac arrest and CTAS-1 are required by the ministry. CTAS 2 to 5 are up to us to determine what would be best for our community. And as you can see, that we exceeded all of our response time. Any questions?
Fred.
I just thought of one. What happens, particularly on some of these ones where the ministry requires you to have a response time? What happens if you fail? I mean, what if you're not doing it in time? Do you get penalized financially, or what do they do to you?
Through you, Chair. No, we're not financially penalized for this. However, when we do our ambulance service review every 3 years, we have to show these reports. And if we don't meet the standard, then we have to show what we're doing to mitigate that and prevent it in the future.
Great. Thank you. Any other questions or comments? Seeing none, then can I get a mover and seconder for the following motion, that the report from the Chief Paramedic, Paramedic Services 2525-002, Response Time Standards Report dated March 27th, 2025 be received? I need a mover and seconder. Moved by Little, seconded by Guardhouse. Any other comments or questions on the report? I just want to say it's great to see that we are not only meeting but exceeding these standards. So congratulations to you and your team. Warden, did you have a comment?
I was going to say the same thing. Great work. I think these are probably really excellent results, and I think we should be proud of the effort in such a diverse landmass to be able to accomplish these numbers. Thanks.
Absolutely.
But I think,
Yep.
as I asked Gary at the beginning, I mean, 63% of the time, you're getting people with heart attacks in 6 minutes or less, right? You know what that actually says to me? I mean, I know you're doing a good job. Most of the people having heart attacks live in Orangeville.
So, is that what you're saying?
Well, he's already told me he couldn't get to my place in 6 minutes, so.
There we go. One clarification point. It's not heart attacks. It's sudden cardiac arrest. So when your heart stops. Slight difference, and we can chat about that later. But yes, you are correct that a majority of our calls do happen in Orangeville, which helps us to inflate our statistics a little bit because, as we know, we live in a rural community and it's very difficult to get to every border within 6-8 minutes at times. So.
Great. Okay. Thank you. Any other questions or comments? Okay. So we've got a motion on the floor to receive the report. So all in favor? Okay. Any opposed? Okay. That's carried. That takes us to item 7.2, one-time funding update for Dufferin Oaks. So I'll hand it over to you, Brenda.
Thank you. Through you, Chair McLean. This report is really a follow-up to a previous report that I brought to committee back in January, where I shared that we were successful in receiving some funding through the local priorities and the Equipment and Training Fund. So just a little bit of background on that. In September, we did put an application in for just a little over $115,000 worth of requests. In January, we found out that we were successful with $32,000 and a bit more than that, just to purchase some, I believe it was bariatric mattresses, bladder scanner, and I'm trying to think what else there was, but a few things there. And I do remember that there was a question that came through asking whether there would be further opportunity to apply again. And I stated at that time that I wasn't sure, but what I didn't know is that they were going to go back and reconsider those applications if they had the funds to do so. And we found out that they did. So we received notice that we are receiving just a little over $34,000, and that is for ceiling lifts in resident rooms.
Great. Thank you. Yes, Warden.
How many ceiling lifts does that buy? The 34,000, how many would you get?
Yep.
5?
Counselor Nix is correct. That's 5. So that will bring us to 34 ceiling lifts in the home in total. So our goal is to keep building that inventory.
How many do you need, do you think?
Ideally, at some point, we probably need 160.
Is that right? Okay.
Could potentially, yeah.
Okay. And in there was an election, right?
That's correct.
Okay. Councillor Wrench, you have a question?
Thanks. Yeah, through you, Brenda. So, in essence, you've received about half of what you applied for. Is that how I can read the report?
Through you, Chair, yes, that is correct.
Thank you.
Okay. Any other questions or comments? Okay. Seeing none, then can I get a mover and seconder for the following motion? That the report from the Director of Health and Human Services, Report Health and Human Services 2025-010, one-time funding update for Dufferin Oaks, dated March 27th, 2025, be received. Need a mover and seconder. Moved by Post, second by Nix. Any further comment, questions? Okay, seeing none. All in favor? Okay, that carries unanimously. So that takes us to the next item, 7.3, Dufferin Oaks Declaration of Compliance. So this is our last report, and back over to you.
Thank you. Through you, Chair McLean. Again, members of committee may remember this very similar report that came through last year. So annually, we are required to provide a declaration of compliance to Ontario Health stating that we are in compliance with our long-term care home service accountability agreement. So that's just stating that we are complying with all requirements within the agreement and bringing this forward for signing.
Okay, thank you. Yep, Councillor Nix.
Yeah, same question I sort of asked Gary, not Dufferin Oaks, but there must be some long-term care homes that aren't in compliance. What does the ministry do then?
At that point, I would believe that the Ontario Health would need to do follow-up with them because this is the basis of our funding. This is how we receive funding. So if they're not in compliance, it could impact that.
Funding.
Yes.
Any other questions or comments? No. Brenda, have we ever been in non-compliance, or are you aware of other municipalities that have had this issue?
Not in regards to their service accountability agreement.
Okay.
We've always been in compliance, and I haven't heard of other homes that aren't.
So next.
Do you have any figures on the rate of compliance of long-term care homes, the public-owned versus privately owned ones? I asked that to go back to the pandemic. Clearly, the privately owned ones did a much worse job than the publicly owned ones, right? So does that show up in the, or maybe this is, you don't know these statistics, but I'm curious.
So through you, Chair McLean. So I just want to differentiate between compliance as per compliance to the standards to operate a home, and then a long-term care service accountability agreement has different requirements under it. So it's making sure that we complete education and that we have plans in place. The compliance that you may be referring to is more around legal requirements, so compliance, having inspectors come in the home and seeing that we're providing care to the residents as per the Fixing Long-Term Care Act. So the question you're asking, I know that Advantage Ontario, which is the association we belong to, they do keep a compliance dashboard is what they would call it, and it lets us know, the number of homes, and it's typically the nonprofit homes, what the number one compliance concerns are per se, or if there's orders being provided to homes, like what the number one thing is that's causing that order to occur. I'm not aware at this time of anything that I'd be able to access that would break it down across with nonprofit versus for-profit.
Okay. Any other questions or comments on that report? Okay, seeing none, I need a mover and seconder for the following motion, that the report from the Director of Health and Human Services, Report Health and Human Services 2025-011, Dufferin Oaks Declaration of Compliance dated March 27th, 2025 be received, and that Council authorizes the Warden to sign the declaration on behalf of Council for submission to Ontario Health Central Region. So mover and seconder. Moved by Little, seconded by Post. Any other comments, questions? Okay, Warden.
Sorry, take the vote and then I have a comment.
Okay, so all in favor? Okay, any opposed? That carries. Over to you, Warden.
Just a comment, Brenda. Yesterday, I attended the staff, I don't know, what do we call that, cake? So can you tell us what that stands for at the Oaks? I guess, or Sonia?
Through you, Chair. Thanks, Warden, for bringing that up. So we've implemented what we are calling the CAIC Awards. It's CAICC, which is the acronym for our corporate values of collaboration, accountability, innovation, compassion, and courage. And for the month of March, we had 18 nominees of peers nominating other peers within the county staff team. And we did the first handout of our awards and celebration yesterday at Dufferin Oaks and had cake. So we know already, I think, for the next month, we have probably about 30 nominations. Okay, wow. So it seems staff's happy that we've introduced this and that there's been good uptake so far. So we're really excited to read the nominations that come in. There was some really great ones, and because this is Health and Human Services, I'll talk about some of the nominations, but some really terrific nominations from Dufferin Oaks staff for their peers, just indicating how I think truly compassionate they are and how they support the residents every single day. So it was great to read them.
I was very impressed yesterday with the number of folks that had been nominated from the Dufferin Oaks staff that were there, and actually how thrilled they were to be nominated, which was wonderful to see.
Yeah. No, that's great. Did you want to say anything?
Well, on behalf of the staff at Dufferin Oaks, I just want to thank you for that and thank you for being there. And to your point, they really were, I think they were a little overwhelmed almost. And it was just great to take part in that. Yeah.
Great. Wonderful. Great. Well, thank you, Warden, and thank you, Sonia, for walking us through that. So that takes us to number 8, correspondence. I don't believe there's any. Number 9, notice of motion. Are there any notices of motion? No, seeing none. Number 10, other business. Do any members of the committee have any other business? Yes.
I actually have something that just popped up.
Please.
If I could share with the committee, as you know, we're working with the Ontario Health team, with our Ontario Health team on the planning for the Health and Human Services Hub. And the OHT has a bit of year-end money available to spend. And one of the things that our partnership group has identified is that will be necessary going forward is some additional digital solutions. So whether that's information signs, digital information signs, some perhaps laptops for our shared reception service, or other digital solutions. And they've sent me a memorandum of agreement, which will need to be approved by Ontario Health, obviously, but for them to transfer $50,000 to the County of Dufferin so that we can work towards implementing some of those initiatives and get started on creating some shared digital solutions.
Great. That's great. And Sonia, just on that, so whenever the decisions are made in terms of where that money would go, would you guys be reporting that back in?
Through you, Chair. Great question. How that money will be spent, we'll certainly report back to council, but it'll likely be determined through that big partnership group, because there are a number of partners that will be working collectively to bring this thing to life. But absolutely, as we proceed through the process, we'll report back.
Excellent. Great. Well, that's great news. Thank you for sharing that. Do any other members of the committee have anything else to share? No? Okay. So then that takes us to adjournment. I need a mover and seconder. I need a mover and seconder to adjourn. Moved by Post, second by Guardhouse. Anyone opposed?